Mm-hmm.
Welcome back, everyone. We're excited to have our next presenter with us today. By all means, if you have a question during his presentation, you can add it to the Ask a Question box, which is next to the chat room. But we're excited to have the topic that Dr. Mitchell is going to do for us today. We're honored to have him. Unfortunately, he would have loved if we were live in his hometown there in Phoenix, well, where he's located. I don't know if it's his hometown, but we're thrilled that he was able to join us virtually to give this talk. Dr. Mitchell is a naturopathic physician specializing in rheumatology and works with patients with various autoimmune diseases. Dr. Mitchell is a proponent of integrative medicine and works alongside rheumatology specialists in Gilbert and Scottsdale, Arizona. His special interests include various autoimmune diseases, including Sjogren's. I know you're going to learn a lot about alternative treatment approaches coupled with information on traditional therapies for Sjogren's as well. I think what's really unique about Dr. Mitchell is he works hand in hand with rheumatology specialists, as I said, and that's a unique specialty. A lot of our naturopathic physicians work on their own, but Dr. Mitchell has learned so much about autoimmune diseases working alongside the rheumatology specialists and caring for rheumatology patients. So we really appreciate Dr. Mitchell's commitment to that, and we know you'll look forward to his talk. I'll be back up to moderate questions when he finishes. So the floor is all yours, Dr. Mitchell.
Thanks for introducing me and having me here, Steve. And I'll look at it as a plus that we're doing it this way because it's so hot in Arizona. All right. So a little bit about me. I'm a naturopathic physician, as Steve said, working alongside a rheumatologist. Some of you may know him, Paul Howard. He's a rheumatologist. This is our squad here. There's Teresa on the far right, best nurse in the world. She likes to party. Why'd I get into rheumatology? I just found the concept of your own homeland security turning against you really fascinating, your immune system. And as a naturopath, I look at the body and I consider it infinitely intelligent. And is it really just a confused immune system, or is something else going on? And we'll get into that. So here's our objectives. And I'm going to try to compress this into 20 minutes. I'm not very economical with my speech at times, so I'll do my best. What is integrative medicine? We'll talk about etiologic factors and tips to take home to discuss with your specialist. So Sjogren's disease, isn't that the one with just the dry eyes and the dry mouth? Well, actually, it's quite a bit more than that. And that quite a bit more explains why many of you who have been diagnosed may have had a tough time getting diagnosed. For some, it was a long trek through many doctor visits and different specialists to get there. The sicca complex, xerostomia, dry mouth, keratoconjunctivitis sicca, those are the prime features, but can actually be secondary to a lot of different autoimmune diseases. What I hear the most of in terms of these additional manifestations is CNS involvement, mood disturbance, brain fog, really, really bad fatigue. The fatigue is tremendous. You do chores, and that wipes you out for the day. Gut involvement. You can have irritable bowel syndrome. You can have SIBO, small intestinal bacterial overgrowth, and we'll get into that. Lung disease, interstitial lung disease, scarring and fibrosis of the lungs. Skin involvement, rashes, vasculitis. Some early cases of Sjogren's have neuropathy. Muscle pain and muscle weakness. Arthritis, sometimes mimicking rheumatoid arthritis or lupus. And renal or kidney involvement. And guess what? We're still short on good treatments for the manifestations of Sjogren's disease. There's topical agents for the eyes, cholinergic agents for the mouth. There's hydroxychloroquine for the joint pain and possible fatigue. And for some of these other manifestations, we've got B-cell depletion therapies like rituximab or Rituxan, which I don't know what happened to my slide here, which aren't foolproof. An investigation is still being done. And remember this slide because there's going to be a quiz at the end. But, you know, I understand a lot of patients' aversions to medications because they take some and they end up taking a lot more. And this is really what we want to avoid. And so what integrative medicine is essentially using all the tools in our toolkit. And so that's using some of these additional modalities. And a big part of it is lifestyle medicine that I'm going to talk about to get us some better outcomes. And so the pharmacology aspect, I was adamantly opposed to earlier in my studies, but my understanding has evolved, and certainly working with these patients, I have seen evidence of these things working. But a lot of the nature cure practitioners of old said that the naturopaths and nature cure practitioners of the future would have a really, really difficult time treating patients with natural modalities alone. And why is that? We don't live in the same world that we did 100 years ago or even 30 years ago. And we have way, way, way more stressors and environmental insults than our predecessors did. And so as a side note here, if you know anything about the history of rheumatology, we've made huge leaps in the way that we treat these diseases with DMARDs and biologics, and we just don't see the terrible adverse outcomes that we used to. But the hunt is still on in Sjogren's land. And so integrative medicine is giving us the best of both worlds. And so a lot of this is DIY material, things that you can do yourself, okay? And there's some things that you might need some help with from a clinician, but there's a number of things that we look at here. So the food you eat, okay? Your circadian rhythms. We'll talk about all these things in more detail. Your stress management, your gut health, environmental insults, the people in your life, and the ideas that you hold. So the food you eat. Food isn't just fats, proteins, carbohydrates. It's building blocks for your immune system, your homeland security, so that it can regulate itself properly. So that communication can happen properly, and that is dependent on micronutrients that you eat. So you don't succumb to COVID, so your predisposition for autoimmune disease isn't turned off, so you can quiet things down. So there's been studies done in rheumatoid arthritis, and I don't know if you can do this anymore, and IRB would consider it unethical or maybe get upset at an investigator. But these arthritics were fasted for several weeks on just water. Their tender and swollen joint counts were looked at, inflammatory markers, morning stiffness went down after 2 weeks of nothing but water. The subjects would eat again and all their joints would blow up. Their CRP and their SED rate would go up. They became stiff again. And this led to food challenge type studies in different autoimmune diseases that incriminated several categories of food. And then came the idea of elimination diets. And we have these two gals here that I've had the pleasure of meeting, Angie Alt on the left and Mickey Trescott on the right, who put together this dietary approach and this user-friendly way of doing it called autoimmune paleo. Identifying and excluding these triggers. And so what are the triggers? So the grains, bread, pasta, cereals, bagels, pretzels, beer, quinoa, couscous, millet, sorghum. Anybody like Pop-Tarts? That was my breakfast every morning in high school. Dairy, okay, cheese, yogurt, milk, pizza, nuts and seeds, eggs, legumes, nightshades, potatoes, peppers, eggplant, spices, paprika, things like this. Processed junk that most people shouldn't be eating anyway. Items in a box or a bag with really high polyunsaturated vegetable oils and a bunch of other ingredients you can't read. And so, yeah, it's quite an exhaustive list. And I'm wondering, how much of the audience is left after, seeing this, and it's like, screw this guy. This is all my favorite foods. So what do you eat? What do you focus on? You eat leafy greens, you eat vegetables, you eat fruits, you eat fish, seafood, you eat meat. And I just threw that one in for fun. Okay. And so you might say now, well, I eat dairy and it doesn't seem to cause issues. And what I tell patients is, does a fish know it's wet? Do you think a fish knows it's wet? It's always in water, right? And say it gets up on a fishing boat by a fisherman and it learns really quick that it was in water. And then it gets back in the water and the fish is like, whoa, that's what it was like to be wet. And so too is it with these food triggers. You're making these antigen antibody complexes to these potential triggers you're eating, and those antibodies persist and they take several weeks to go away before you finally have a chance to be dry and you have the food that is a potential trigger. And it's like, whoa, X or Y wasn't bugging me before and it isn't doing so anymore. And then you have it again, and you know what it's like to be wet. So obviously this isn't a sustainable approach. And how I approach this clinically is we have patients dive head in for 6 weeks, and then we diversify the diet methodically to look for specific triggers so that we can build a diet for Bonnie or Sue that's specific to Bonnie. We want Bonnie on her diet. We don't want her on paleo, vegan, keto, Atkins, whatever. We want the diet that's specific for Bonnie, because Bonnie has an autoimmune disease with her own specific triggers and maybe does okay with dairy, but Sue doesn't. Okay. So the next area is your gut health. You've got 3 to 5 pounds of bacteria in your digestive tract. They eat first, they eat last. They do neat things for us, like make vitamin K and B vitamins and synthesize short chain fatty acids. And they regulate our immune system when we have the right ones. If you have the wrong ones, you were at Rocky Point, you ate Morisco's under the bridge and you got sick, there's a chance you picked up some bad ones. Or when I'm taking a history and I learned that somebody had recurrent childhood illnesses of ear infections or strep throat and they're recurrently using antibiotics, it's more probable that they have what we call gut dysbiosis, which can cause something called leaky gut syndrome. And so this is something that has been looked at in all sorts of rheumatic diseases. And it really tickled me pink to recently hear this phrase come out of the mouth of a rheumatologist, Greg Silverman, Associate Director of Rheumatology at NYU Langone University. There was a video on MD Edge a couple months ago of this rheumatologist using the phrase leaky gut syndrome. Okay, so what was considered pseudoscience and quackery, 10, 20, 30 years ago is, I think, something that will be looked at in mainstream medical practice in the coming decades. And this is what leaky gut is here. So you can see these enterocytes. And when you have these insults that atrophy these cells and disrupt the tight junctions between them, you have items from the intestinal lumen getting into the bloodstream, and this can trigger a chronic inflammatory response. These are just some of the publications as they relate to Sjogren's disease and Sjogren's syndrome specifically. SIBO, or small intestinal bacterial overgrowth, which is basically your gut bacteria in the wrong place. We want those in the terminal end of the small intestine and the large bowel, and sometimes they translocate up into the small intestine and can cause some of these problems. And what we do for these issues, these are just some other publications related to Sjogren's and dysbiosis. What we tend to do for this is what we call the 4 R's in naturopathic or functional medicine. So the first is removing the bad guys, all right? And so that may be done with antibiotics or herbal antimicrobials. And then there's replacement. Okay, so if you go back to that picture of those enterocytes, they have these little finger-like projections called villi. And on the surface of the villi, you have that area is called the brush border, and there's digestive enzymes that help break down the food you're eating so that it doesn't become food for bacteria, and they secrete emissions that cause inflammation, and so that the food you're eating is broken down properly and doesn't get into the bloodstream and cause inflammatory responses. And so we remove, we replace, we restore the right guys, and then we repair. So using things like slippery elm, probiotics, aloe vera, things that will help that atrophy of those enterocytes and close up those spaces that we talked about. Okay. Chronic infections. So there was an MD PhD at a Johns Hopkins University. His name was Thomas McPherson Brown, and he was a rheumatologist that the rheumatologist I work with here in this clinic spent some time with in DC. And Dr. Brown believed that most cases of autoimmune disease were caused by some low level of some sort of infectious agent. And this has been something that there's still ongoing investigation for, and we can often find serological evidence of pathogens that individuals have had in the past, but what we don't know is whether these pathogens are perpetuating an infection. And so the jury's still out there, but there's a lot of translational research, and I know this is hard to read. Remember this as well. There's going to be a quiz on it at the end. There's a lot of translational research incriminating all sorts of bugs as initiating agents and possible perpetuating agents of autoimmune disease. The problem, I think, in my belief, in understanding this better and getting definitive answers is that a lot of the investigators whose work I've come across is incriminating small categories of bugs or a single pathogen. Brown believed it was Mycoplasma pneumoniae, and he would treat patients with tetracycline. You've got Wyburn Mason, who thought certain forms of autoimmune arthritis were caused by protozoa. You've got this celery juice guy. Anybody heard of him? The medical medium. He blames everything on Epstein-Barr. If you got a dent in your car, it's probably Epstein-Barr virus. But if it, it's probably not one thing. And the most profound case I've had that was relevant to this sort of thing was a gal with a positive ANA, double-stranded DNA. Paul said, I'm not really sure what she has. It doesn't seem like lupus. Maybe it is. She's got arthritis, fatigue, pruritus, which is medical speak for itching skin, and diarrhea, severe fatigue, so severe, she'd do a chore and just be on the couch for the rest of the day. And so rheumatologist said, hey, Bill, I don't know what's going on with her. What do you want to do with her? And it's like, well, I don't really know what to do with her. So I took her history, and she had tried a lot of different things, and it was clear she had an inflammatory component responsive to prednisone. But we ran some labs indicating that there was a possible EBV reactivation, and I gave her a herpes medicine. And she looked at me like I was insane. And I said, look, it's cheap, it's safe, let's just do it for 6 weeks. And she walked 2 miles for the first time after that 6 weeks and many, many months. Her diarrhea went away, skin itching almost entirely gone. Rheumatologist thinks it was placebo, perhaps it was. I shrugged, but Epstein-Barr virus. She had a double-stranded DNA. Epstein-Barr is a herpes virus. Herpes viruses have double-stranded DNA. So that's how I kind of put that one together in my head. But chronic infections, something that we look for. Toxicants, okay? So toxins, you probably read a lot about toxins in the environment, better living through chemistry. This is sort of a morbid picture, but I really like surrealism and odd art. Hieronymus Bosch, Salvador Dali. I really like this stuff. But better living through chemistry. There's a price to pay, though. I like my plastics and my Tupperware and my convenience like everybody else, but these things affect our bodies and our immune system. And we don't have time to get into all the nitty-gritty today, but there's a really neat book you can get on Amazon written by Sherry Rogers. She was a medical doctor, head of the American Academy of Environmental Medicine. And there's a lot of literature in there incriminating these toxicants and immune system dysregulation. We have our liver and kidneys, which do the job for most of us, but these biotransformative pathways, this xenobiotic defense system we have, can get overwhelmed because of continuous exposure, poor micronutrient status, and we end up tucking these things away in the body. Couple that with constipation, not hydrating properly, not sweating frequently, and this stuff starts to spill over and affect these different communication pathways in the body, and you can cause disease. And there's actually clinics that treat this sort of thing. William Rhea, he's a medical doctor in Dallas. He puts you in a bubble for months and makes you eat super clean and sweat ridiculously. And we have some clinical data. It's not strong clinical data, but it's very suggestive in electrical workers, 9/11 workers, Gulf War veterans, showing that when you detoxify them, their symptoms get better. And so these are the components of addressing this particular etiology: identifying exposure sources, making sure you're having regular bowel movements, make sure you're eating foods or taking supplements that augment that xenobiotic transformative system, that defense system. Sometimes we use pharmacologic agents, cholestyramine to help drag things out, oral chelating agents, and sweating. That's the one thing you can do on your own that's incredibly helpful: sweating. Circadian rhythms. Every cell in your body has a clock. Your primary clock is in your suprachiasmatic nucleus of your hypothalamus. Okay, that's largely regulated by light, but it's also regulated by social cues, environmental cues, meal timing. Your body likes routine. Routine is good for you. We call these inputs zeitgebers or time givers. Your immune system doesn't work so well if your lifestyle is erratic. You're going to bed at different times every night, or even just on the weekends. We call that social jet lag, and there's literature looking at this social jet lag. You're eating erratically. You're exercising at 5 p.m. one day, 11 a.m. the next day. Regularity and routine. Your immune system likes that. Sleep is very important, okay? And so if your sleep is messed up, you're going to be swimming upstream in terms of healing. And some basic things here is making sure you're eating enough. Sleeping requires energy, which is kind of a funny thing to think about because you're sleeping and you don't think you're doing anything. But a lot of things happen while you're asleep. You need B vitamins, carbohydrates, proteins, and calories to sleep well. You need regulated blood sugar. You got to have a good nighttime ritual. read hot tea and a book instead of being on social media, limiting screen time, take a hot shower before you go to bed. And we'll get more into the social media bit because I think that's really important. But cooler sleeping temperatures, caveating that for folks with Raynaud's, I think a target for bedroom temperature should be anywhere from 69 to 73 degrees. Stress management, and you've heard this a lot. You've got stress, I've got stress, we've got big stressors, little stressors. I can't tell you how many times I'm taking a history and I've heard a patient say just merely before the disease onset, maybe weeks, they got a new job, there was a divorce, there was a death in the family, or how about those super type A CEO women redlining it for months, years, and then eventually the wheels fall off. Exercising too much. Exercise is a double-edged sword, okay? It's a stress on the body. I've got one gal who CrossFits and does high-intensity interval training 5 to 7 days a week, an hour, and she feels best when she goes away and eats whatever she wants and chills out and isn't exercising so much. But alas, I can't convince her to dial it back. And so you've got two branches of your autonomic nervous system. You've got fight and flight and rest and digest, and most of us are too overly fight or flight. Okay. And it's this moment to moment fluctuation in your heart rate, or what we call heart rate variability. And so when you come into that you can use to track where your fight or flight versus rest and digest is. And when you come into the office and the doctor takes your vitals, they put a pulse ox on your finger and it's not statically at 81. Moment to moment, it might be 56, 71, 92, but it averages out at 81. And we want more variability. We want more up and down. Less variability, you're more chronically stressed. And there's apps you can use to look at this, tracking a score called RMSSD, a real accepted measure in the literature. And that app's called HRV for training. It's a couple bucks. You just use a finger sensor through your camera every morning and it tracks that. But what are the things that build your resilience to stress? It's making time for play, okay, which I know is really hard to do right now because of the pandemic. But technology and what we can do online really helps us out here. Board games, video games, Scrabble, Battleship, dancing, getting out in nature, singing. A word on singing. Singing is powerful medicine, okay, and that activates your vagus nerve. And so sing loudly every morning like you're drunk and no one is watching you. I like to sing Rush's Xanadu or the Necromancer in my car on the way to the office every morning. Sometimes I'll look at the driver on my left or right and try to pull them into it too. But make sure you're using uplifting music. Don't listen to Hurt by Nine Inch Nails or songs that bring you down. Okay, nature, exposure to nature. We've got studies showing that simply putting up paintings or posters of desert, sea, mountains, or forests can actually affect your autonomic nervous system. The best medicine is getting outside, again, tricky because of the current state of affairs, but powerful medicine. Hiking, rock climbing, a stroll in your local park, getting exposure to trees, grass, bushes, dirt paths, powerful medicine. The people in your life, your social networks. This is really, really important stuff, okay? Really profound here. I went out to the Sjogren's walk, I think it was 2019, and met a lot of you fine folks. And I was part of a panel, and a lady approached me afterwards, asking a few questions. And she told me that she didn't need any of what I had to offer. And I looked at her and I said, "That's awesome. What did you do?" And she said she had a pain in the ass boyfriend and she kicked him out of her living situation. She said, "No, Moss, I don't like this. I don't have to deal with this. My health is very important to me." And I'm not suggesting you do anything extreme as soon as this conference is over. And really only you know the answer to that, but it's certainly something to think about. And so how are the people in your life making you feel? Are they making you feel warm and fuzzy? Are they making you feel sad? Are they making you use forbidden words? Are they making you feel, lascivious or turned on? Are they making you feel queasy? These are things to think about and things you should check in with yourself regularly to make sure that your interpersonal relationships are healthy. What are the ideas that you're filling your head with? There he is, whether you love or hate him in all of his glory. But are you consumed by the tribalism of politics? Is there a background sense of combat in your mind? COVID-19. Are you eating up the clickbait and sensationalism of the media? And I'm not downplaying COVID-19 at all. This is a very real issue. But, you have to understand what the media does to drive ratings. And, I started to put this in my treatment plans. CNN and Fox, it's poison. Okay, take a break from CNN and Fox. This stuff works people up and that affects your immune system. Social media. Are you joining in on pointless endless back and forth conversations that end up as echo chambers, threads consisting of 30 plus comments that aren't going to change anyone's mind anyway? There's doing it to learn and grow as one thing, but there's doing it and doing it unproductively as another. Instagram, a fun app I use myself, but it's a two-edged sword. We have these unreal standards of beauty, living the good life that are fictitious and fabricated. It's easier to compare yourself to others. Some folks are more sensitive to that. Ever heard of the Factor 5 personality scale? A very well-accepted model in psychology. You can predict who is able to regulate this self-comparison better and who is not. And that can lead to depression, anxiety, loss of self-esteem, and hurt, and that affects your immune system. Okay? Are you creating a narrative in your mind for healing? Are you creating narratives of despair or illness? I've seen some patients crippled by their disease, severe rheumatoid arthritis, for instance, eroded and mangled joints, and they come in and they have the best outlook. They laugh, they're vibrant, they're positive, they look forward to living every day. And then I see other patients who have a little synovitis and morning stiffness, and they're miserable. And I'm not discounting anyone's individual journey. Your journey is unique. It has its own set of circumstances, trials, and triumph, but you need to be wary of the narrative you provide for yourself. Freud and others said etiology is chief. Alfred Adler says teleology, or what is the goal? Teleology is important because you set the goal, and to some degree, we all act out and use our body in the world to achieve that goal. And if the narrative is I will be chronically ill and functionally impaired, and there's nothing I can do about it, then that increases the probability that that's more likely to happen. Your brain is powerful, okay? I'm talking overtime here, so I just want to say one thing about this slide. There's some herbs and things on here, some supplements. Please talk to your rheumatologist or specialist first. Naltrexone. I learned that it was a panacea for autoimmune disease during my studies. I haven't found that. And I've seen it most impressive in fibromyalgia, the fatigue in Sjogren's, and psoriatic disease. Very safe medication. You can talk to your specialist about it. It costs $30-40 a month. Really low dose, FDA approved at higher doses for addiction, off-label for autoimmune disease. 0.5 to 4.5 milligrams a day, usually taken once at night. Talk to your specialist about it. All right, so we'll wrap this up. I appreciate the Sjogren's Foundation, Steve, and others for having me here. It's fun being here for all of you. I wish you the best in your health journey, being safe out there. Take care, and we'll open it up for questions.
Thank you so much, Dr. Mitchell. I appreciate your comments. And I think, as a chat room on the side is saying, a lot of this is things that a lot of time rheumatologists don't talk about because they aren't focused on this side of mental health as well as other options, thinking outside the box, trying to be creative in treatment, et cetera. So that's why I think a naturopathic physician looks at it in a different mindset. So I really appreciate that. You answered the one question on naltrexone. There's not been a lot of great studies on it, except people do find relief from it and find some success, as you mentioned, in fibromyalgia and Sjogren's. So talk to your doctor about that, is what Dr. Mitchell said, and we would agree with that as well. Do you have any suggestions real quick? I'm going to jump around on questions, so you're going to be like a quick fire here. I don't think you went into too many details on this, but any quick supplement thoughts on fatigue?
On fatigue. Okay, so
I know.
Yeah, there's some things that you can take that address things non-specifically, and there's things that you can take that address deeper issues. So let's talk about deeper issues for a second. And this is something that you should bring up to your specialist, your primary care, or whoever. But treating really common causes of fatigue, thyroid dysfunction, really common in Sjogren's. So making sure that your thyroid's in range, and then your iron status, okay? And you can have iron deficiency without anemia. So what that means is your blood counts will look normal. You won't have anemia, but your iron can be low. And we look at a ferritin. It's a more sensitive indicator of assessing your iron status than just looking at a serum iron. And I don't think enough clinicians have an appreciation for that. And so if there's any indication there, getting your thyroid tweaked or treating your iron status. In terms of supplements that you can take for fatigue, my favorite class of herbs is called adaptogens. And these things don't work very rapidly. They take some time to build up in the body, but these are things like, they're on that last slide. These are things like Siberian ginseng, Korean ginseng, rhodiola, ashwagandha. My favorite is holy basil. You can take that as a tea. Do keep your providers in the loop when starting any of these things, because there are potentials for medication interactions.
Mm-hmm. That's great. And I know, we had a question on CBD oil. We are actually, just so everyone knows that's watching, the Sjogren's Foundation is entering some research this fall on CBD and the use of it. We've had mixed results so far from anecdotal information from patients that made more dry, caused more fatigue, and dried them out. Other people have found success from it. There's so many products on the market. You have to be careful where you're buying it from, what it's could be laced with. We had a great article in our newsletter recently. I don't know if you have any thoughts quickly on CBD products, but we will be hopefully coming out with research ourselves in the next year on that. But your thoughts on that?
I'm excited to see that research. And, it's kind of Wild West with the cannabis products right now. And my thoughts are this: the best way of going about it is getting certified for your medical card to make sure you're getting high quality products. In terms of how to use them, no physicians can give prescriptions as to how to use medical cannabis, but I think there's an issue right now with cost efficacy, because if you look at some of the studies that have been done, particularly for CBD and immunomodulation, there's a study in Crohn's disease that's very interesting, and they're using hundreds of milligrams of CBD, and most of the CBD products out there that are higher quality are using really small amounts of CBD. So I think that's part of the issue there. And, things are changing in the political landscape. And I think Big Pharma is going to abduct CBD at some point, which I think will be beneficial in some regard, because, maybe some of this stuff can get covered by insurance, and we'll have standardized and higher doses of CBD that we can use to mimic in those studies.
And that, I totally agree. And the article written in our newsletter, which members can find on the member side of our website, talks about looking at that, because every product's different. There's not regulatory agencies overseeing some of that. So you do want to be careful. And I think the medical side of marijuana and CBD is important to look at. I think, Dr. Mitchell, thanks for mentioning that, because it's not just running in a store and buying something. It may or may not work. As well as your comments, and I know we had a lot of questions on diet, and you did such a great job. There isn't one miracle cure diet out there for Sjogren's or any autoimmune disease. It's sometimes trial and error. Working with a nutritionist or a doctor to figure out what's working, I think, was a great, because a lot of questions came on that. Finally, one more question. Primrose oil, I don't think you mentioned that. Someone threw that in. I don't know much about it. Do you know anything about primrose oil? Yeah,
primrose oil is rich in an essential fatty acid called gamma-linoleic acid. Okay, and there have been studies done in rheumatoid arthritis showing that it reduces tender and swollen joint counts and morning stiffness. I haven't seen anything in the way of Sjogren's, but just talk to your doctor about it. I don't think it's something that's harmful, and it could be beneficial.
And I think the one takeaway, and I appreciate for those that, Dr. Mitchell threw a lot out, and I loved your presentation. I know people loved it online as well. They're chatting about how great you were, is you can rewatch this session and stop and take notes. So live, obviously there's no stopping, but when you go back, you can stop. You'll also have his PowerPoint slides, which were sent to you. And so you can always print them out and follow along and write notes and stop and start the video as you all want. I think the thing about Sjogren's, as we all know, I've been in the field for 17 years working with Sjogren's patients. I'm not a physician, is not everything works for everybody. And it does take trial and error, and it does take working with doctors, finding a doctor that will work with you. Not everyone has that, we know. Of course, now with telehealth, you are able to take part and talk to doctors in other parts of the country that do appreciate Sjogren's more, and maybe have a once a year consult with a doctor from somewhere else to learn more, to have them look at your files, et cetera. I think telehealth will change the way patients are treated long term. Do you agree with that, Dr. Mitchell?
I totally agree with that. Well said. And one of the things I do is I consult with patients out of state, and a lot of the time it's helping them get a diagnosis faster. So I don't diagnose or treat, but I'll say, hey, this is who you should talk to, and these are the providers that you should get plugged into, because it can be very frustrating for patients trying to get this all sorted out in the beginning, But yeah, there's a lot of nutritionists and folks out there. Angie Alt and Mickey Trescott have a health coaching program that they take groups of people through and walk them through this autoimmune paleo approach. And again, it's finding a diet that works for you.
And we do on Sjogrens.org have a couple different books on different diets that are available. You can look at our website and look at those. You can also buy them from Amazon, anywhere else, but we do have a couple different options. And so take a look at our website as well. But with that, Dr. Mitchell, thank you for that elaborate presentation. You touched so many wonderful issues that I think sometimes our patients don't get to hear about because they're listening to traditional doctors who are amazing and do, amazing work with our patients. But sometimes it takes someone to mention other things to start thinking about. I will emphasize what Dr. Mitchell said is you want your doctors to know if you're taking supplements, what you're doing in addition to the traditional therapies, just so they have it in your record, so there isn't any contraindications, or they can find out what's working and maybe take you off something else or change up something else. So you need to make sure your one rheumatologist or primary care doctor, whoever that is, does know what you're doing in addition to the traditional therapy. So, and I say traditional, supplements are traditional too, but you just want to make sure someone knows what you're doing because they also can learn too. You never know what a doctor can learn because they found out that you were taking some supplement, and it might help them treat their patients down the road better as well. But thank you, Dr. Mitchell.
Thank you, sir. Very well said, Steve. I'm pleased to be here, and I hope everybody be safe and have a great rest of your weekend.
That sounds great. Thank you so much. We're going to wrap this session. For those watching, just sit where you are, and we're going to come back and get you in 1 minute with our next speaker. Again, if we lose you in the transition, you can go to the drop-down menu and click on the next session, which will be session 12. But for most of you, 95% of you, just sit there and we'll be able to take you over. But if for some reason we knock you out, that's how you'll get back in. So I'll be right back with our next speaker. Thanks again, Dr. Mitchell.